So our today's topic of discussion is muscles of medial or adductor compartment of thigh. The medial compartment of thigh is also known as adductor compartment. It adducts the thigh. So the muscles of medial compartment of thigh is divided into two parts, the extrinsic muscle and the intrinsic muscle. First of all, we should know what's the difference between extrinsic muscle and intrinsic muscle. Extrinsic muscles are those whose origin or insertions are from the different region than medial compartment of thigh. Means its origin or insertion are not from the medial or adductor compartment of thigh. It is from the other region of the lower limb. Meanwhile, intrinsic muscles origin or insertion are from the same medial or adductor compartment of thigh. Okay, the extrinsic muscle include obturator externus. We will discuss this muscle in our gluteal region muscles. Okay, now comes to the intrinsic muscle that are the important muscles of the medial compartment of thigh include adductor longus, adductor brevis, adductor magnus, gracilis and pectineus. These are the muscles present in the medial compartment of thigh. Now, the nerves present in the medial compartment are obturator nerve, accessory obturator nerve, and arteries include obturator artery, medial circumflex femoral artery. Now, you can see in the diagram the muscles of the medial compartment. First of all, you can see the pectineus muscle. Below this present is adductor longus muscle. Below adductor longus is present adductor magnus muscle. Now comes to the right part, adductor brevis, you can see it above, and gracilis muscles below. Now comes to the definition of the muscles. What are these muscles? So adductor longus is a triangular shaped muscle forming the medial part of the floor of the femoral triangle. We have discussed the femoral triangle in our previous videos. Go watch the video of femoral triangles so you can understand. It lies in the plane of the pectineus, means it lies below the pectineus muscle. The second muscle is adductor brevis. These muscles lies behind the pectineus and adductor longus. Means first there is pectineus, then adductor longus, then adductor brevis. As we have visualized this in our previous slide in the diagram of the muscles. Now comes to the adductor magnus. This is the largest muscle of this compartment. You should remember which is the largest muscle, the adductor magnus. Because it's double nerve supply, it is called a hybrid muscle. Hybrid means made up of two. It is supplied by two nerves. We will discuss which nerves supplies the adductor magnus in our upcoming slides. Now the fourth muscle is gracilis. Gracilis comes from the Greek word which means slender. And the last one is pectineus. This is flat quadrilateral muscle. Okay, it is quadrilateral in shape. It forms a part of the floor of the femoral triangle. Okay, it forms the floor of the femoral triangle. Now comes to the nerve supply and actions or functions of these muscles. Adductor longus is supplied by the anterior division of obturator nerve, means it is supplied by the anterior part of the obturator nerve. The adductor muscles act as posture controllers, means it control our posture. And what is the action of adductor longus? It is the powerful adductor of thigh at hip joint, means it adducts the thigh. Okay, now comes to the adductor brevis. Adductor brevis nerve supply is from anterior or posterior division of obturator nerve. It is the adductor and flexion of thigh. Its action include adductor brevis help in adduction and flexion of thigh. Now comes to the adductor magnus muscle. It is the hybrid muscles, means it is supplied by the two nerve. First, it is supplied by the adductor part by posterior division of obturator nerve, means posterior part of obturator nerve supply its adductor part, and its hamstring part is supplied by tibial part of sciatic nerve. Now, adductor magnus has two parts. Its adductor part and the second is hamstring part. Adductor part is supplied by obturator nerve, posterior division, and hamstring part is supplied by sciatic nerve. Which division of sciatic nerve? Tibial part of sciatic nerve. What's the action of adductor magnus? It causes adduction of thigh. Okay, the adductor part causes adduction of thigh, and the hamstring part of the adductor magnus helps in extension of hip and flexion of knee. Means it helps in extension and flexion. Gracilis muscles is supplied by the anterior division of obturator nerve. Meanwhile, its action is the flexor and medial rotator of thigh. It is a weak adductor of thigh, means it is not the powerful adductor of thigh. Which one is the powerful adductor of thigh? The adductor longus is the powerful adductor of the thigh. Okay, gracilis is the weak adductor, and it is used for a transplantation by damaged muscles. Okay, we can transplant the muscle gracilis. Now the last muscle is pectineus. Pectineus is also supplied by two nerves. It has dual nerve supply. Okay, the pectineus is divided into two parts: posterior fibers and anterior fibers. Its anterior fibers is supplied by femoral nerve. Meanwhile, the posterior fiber is supplied by anterior division of obturator nerve. Its action include it is the flexor of thigh, means it flexes the thigh, and adductor of the thigh. Now comes to the arterial supply, means the blood supply of the muscles of medial compartment of thigh. So adductor longus muscle is supplied by obturator and deep femoral artery. Adductor brevis is supplied by deep femoral artery, and adductor magnus is also supplied by deep femoral artery. Pectineus muscle is supplied by medial circumflex femoral artery and also by obturator and deep femoral artery. Gracilis muscle is supplied by medial circumflex femoral artery. Okay, now the mnemonics from which you can remember the muscles of the medial compartment of thigh is A3 or AQ. A3 means there are three muscles starting from A: adductor longus, adductor brevis, adductor magnus. And postgraduate, we often say or see a postgraduate doctor. So from this you can remember P is for pectineus and G of graduate is for gracilis muscle. Thank you so much for watching the video. Don't forget to subscribe the channel and like the video. And this is the video which covers the most important part of the medial compartment of thigh, that is its muscles, its arterial supply of the muscle, and the nerve supply of the muscle, and actions of the muscles. Thank you.